Hi, and welcome back to another episode of The Talk. This week, we're talking to two healthcare experts about the effects that COVID-19 is having on our children. How safe is it to take them out with everything opening up at the moment? Masks, they're supposed to be wearing masks. Is that safe for children? And when schools go back in September, the KHDA is requiring that all children over 6 wear masks as well. So how will that affect them and their immune systems? Let's find out. So welcome back again to another episode of The Talk. Today we're going to be talking about how we can look after our children as the restrictions start to ease across the UAE. And with me on the show today, we've got Dr. Wafa Faisal, who is head of the Department of Pediatrics, consultant pediatrician at Dr. Suleiman Al Habib Hospital and Medical Centre. And we also have Dr. Polak Zenia Yadagari, who's a specialist pediatrician at Medcare Pediatrics Specialty Clinic. So thank you both for being here today.
Thank you so much for having us.
Thank you for inviting us.
So I guess we'll start off with what most parents are probably most concerned about, and I'm sure you can provide them with some reassurance, which is things across the UAE are opening up quite quickly. There's lots of changes. They seem to happen quite quickly, sometimes overnight. How safe is it out there for kids, and how should parents be feeling about getting their kids back out into the wide world, Dr. Wafa?
Okay, yes, basically the rules are loosened now, and we are happy because we've been passing through a lot during the quarantine, especially the kids. Really, I feel sorry for them because these creatures, these lovely people, they need to play, they need to enjoy, they need to explore. So it was not easy for them, and for us as parents also to see them just locked down in the house. And unfortunately, we were allowing them to have more time on the screens because that's what we had to do in that period. So from now on, I think, no, we can take them out. But still, though, for those who are above 6 years of age, they need to keep the mask if there is crowd or people, there is so much people in the same place. And for those under 6 years of age, they allow them to be without a mask. But the most important thing for me, honestly, is the hand washing. The parents should always continue, always to educate their children about hand washing and not to touch their face, eyes, nose, and their mouth. And to wash, of course, before and after eating anything or trying to put anything in their mouth. So hand washing will still be there. For example, the beaches are open. The beaches, if we are just a family or two that we know each other very well, and we know that the other family or the friends are taking the same precautions as us, there is no harm of being together on the beach. We can get a space for us, away from people, and allow the children to enjoy and to swim. And of course, we'll wash the hands before they will eat anything or after they come from the water. And we'll be taking care. And this goes to any other activity they are going to do. We apply this to any other activity, wherever we take them, for example, for skateboarding or any other activity or walking outside. Hand washing is the most important thing to me.
Lockdown was lifted. It's very important the parents to continue to educate the kids about the COVID and about the precautionary measures, to make them to understand what is COVID, what is the virus, and how to protect myself and how to protect the others. This education should be continued all the time because the COVID-19 is something which we have to live with. And until the medicine and the vaccine will be available, the kids from 4 years, according with them age and the level of mental development, they have to understand how to protect myself and how to avoid getting the infection.
And what about their immune system? Should parents be worried? Should they be giving their children immunity boosters because they've been away from germs for so long?
Yeah, because this lockdown was there for a while. Of course, we create immunity. We was protect about COVID, but we get less immunity against the other germs. For that, the most important role for the parents is how to improve the immunity of kids. That coming from, first of all, from the very healthy life. That means very healthy diet. The diet should be very well balanced, to be full of proteins, fat, and lipids, and to have very less sugary things. The diet should be based on fruits and vegetables, usually in these which are very high contained in vitamin D, C, and E. If the parents feel the child is weak, it's better to have a consultation and talking with the doctor to check the vitamin D level, which is very important for the kid immunity. Not like protection against the virus, but to increase and to boost the immunity. How doctor said it's very important to get them out, but gradually, to avoid the crowded places, to maintain the distancing, to limit the exposure of the kid outside. It's better also to have exercises, to have access to the swimming pools, to the beaches, to the playing area, but how the doctor said before, with all the precautionary measures to be done.
And obviously, children do pick up a lot of bugs, especially the smaller ones. At what point should parents start to think, well, maybe I need to take my child to see a doctor? What sort of symptoms are they really looking out for when it comes to
usually for our patient, we have a regularly, because we are pediatrician, we are seeing the regularly our kids. Usually in this situation, they have to bring the child. If they feel any weakness or any failure or loss of appetite, or the child is not that much energetic, even if there is no any symptoms of viral infection, it's better to meet the doctor, and the doctor will advise what is the next step to do.
And Dr. Waffer, I think
Yes. Yeah, can I comment also on the immunity part that as the doctor said, yes, the healthy diet and exercise and some vitamins, and the most important for me is vitamin D, because we are not exposed to the sun during this the previous period. And now if we're gonna take UAE, for example, the weather is very hot, so people are not able to also be exposed to the sun, especially in the peak times. So vitamin D should be there for the children all the time. And regarding the visits, yes, I want also to remind the people that the vaccination visit, the regular vaccination visits also should start, and they should try to catch up with any missed vaccine that they couldn't have done in the quarantine period, because also we don't want other diseases to come and to flare up, and these diseases can be prevented easily because we have already the vaccine. Yes.
And you actually mentioned masks for the over sixes. I'm sure that you've seen that the KHDA have made a new ruling that children in school from September will have to wear a mask. How's the safe mask for children? Should parents be worried about their children wearing a mask all day at school, or?
We can remove the mask. If we are not surrounded with people, we are alone in the car, we can remove the mask. The same applies to the children. If they are in the classroom, it's preferable that they keep the masks on, their covering their nose and mouth. While if they are, for example, in the playground playing away from each other, they can they should actually remove the mask, especially if they are running or having a heavy exercise or moderate to heavy exercise. They are encouraged to not to be having the mask at that time. And we can also ask them whenever they feel they are dizzy, they are not able to breathe, also they can remove the mask, because their safety comes first. We don't want to have another problem from the mask. The most important, when we are among the crowd, when we are among the crowd or talking to the people which are like nearby to us, or engaging in a conversation, so it's better to have the mask. Yes.
And should parents, Dr. Polixenia, should they feel safe that their children, reassured, that it's all going to be okay when their children go back to school? I know the schools are putting in a lot of measures. Do you think it's going to be a safe place for children to be come September?
For the children to go back to school from September? Yeah, according with the government rules and all the measures which was in place, I think is a safe place for the kids to go, because the distancing will be there, wearing the mask will be there. They will be teach how to wear the mask, how to dispose the mask, how to remove the mask, how to wash their hands after. all these things. And with the distancing and with the mask, I think everything will be okay. They can back to school.
And I guess it's
before go to school.
I guess their mental health as well is something that we need to.
Yes, it's important. And thankfully, I want to mention that children are getting a milder disease, which is well known to everyone now. And to children, so far, it's like similar to any other viral illness. Of course, certain cases, we all knew that certain cases had like Kawasaki, like disease and like that from the COVID-19. But thankfully, there are limited numbers. Thankfully, coronavirus like spared the children, if you were going to say. Most of the cases that we saw were very mild cases, similar to any other viral illness. So, which is luckily, if I can say.
Yes, exactly.
Yes.
Is there anything else you'd like to add that you think I might have missed or that you think is important for parents to know, Dr. Polixenia?
Yeah, yes. Before there is some special case with special conditions like diabetes or cardiological diseases, metabolic, genetical, neurological diseases. Also, this kind of kids, they have to go out to after the lockdown was lifted. But before, it's better to go to the doctor to check the health status, and we'll tell them how is the what measures they have to take to be in the safe side, especially for diabetes kids or with asthma. The asthma should be under control and they can go out. And before starting the school, it's better every child to have a checkup to assure the parents they can go to school and everything is safe for them.
Dr. Wafa, anything to add?
Yeah, I want to ask the parents, to loosen a bit the regulations for the children because some parents are continuing the lockdown despite that we know that the rules outside are better. So we can trust really the government regulations and they can go back to school because it's important, as you said, for their mental health. They need to be socializing. They need to grow up healthy from the mental aspect and psychological aspect as well. So hand washing should not be forgotten. The mask for those who can wear it, and I think we're going to be okay.
Brilliant. Thank you so much, ladies. I know you're both extremely busy, so I really appreciate your time. Thank you for coming on and joining me today.
Thank you
so much. Thanks for you. Thank you.
Thank you very much to our two guests today on The Talk. Please do remember to share, like, and subscribe so that you can see all future episodes of The Talk as they come in. Thanks very much for watching, and we'll see you next time. Bye.